Hey everyone, it's Dr. Rick, and today's tutorial is on how to prepare for 2022 and the further variants of COVID and other things that are coming our way. I really think that at this point in time, with the amount of people that have been infected, whether it was the Alpha, Delta, wild type, or now the Omicron variant, that we will have a group, or at least a large majority of the population, having some protection, whether it's from previous infection, and that would be natural immunity because you develop your own antibodies to several different proteins within the virus, or you get your vaccine. You didn't have an infection, and you've been good with avoiding and masking, but you get the infection, you get both either the Moderna, the Pfizer, or the J&J. But regardless, if you get the vaccine, your durability is probably going to be a little less than natural immunity, but you'll still be protected, meaning that it won't necessarily get you bulletproof to not have the infection ever. But if you do get infected, it'll be less severe, meaning that you can probably do a lot of good things at home, get through the infection, get out the other end, and then be stronger. However, the idea, as I've always alluded to with all my videos, is you have to prepare for other things down the line. And then we're always going to have variants. The influenza virus always has a variant, and as you know, it becomes an issue every fall in the United States. And we determine which parts of the vaccine for that year are going to be included in the vaccination protocols based on what happens in the Southern Hemisphere. So usually what happens is the Southern Hemisphere declares their problems because of their fall and cold weather and everybody going inside and getting the infection. Then in our fall, which is usually from September, October, November, and then a little bit in December, we usually try to predict what's going to happen. It's never going to be an absolute matchup, but there have been a couple of years where the influenza vaccines that are put out do match up, and we have a lower problem during the fall. Now, will we get to that point with COVID? Definitely. In fact, it's starting to become it's not the same thing as influenza, but it's starting to become a chronic disease. And I can argue that many cancers are starting to become a chronic disease, but I think that a lot of things are circulating around comorbid conditions. So whether it's an influenza virus, whether it's a COVID virus, whether it's a heart attack, a stroke, cancer, if you control your comorbid conditions, you'll fare better. And just with the aging process, you'll fare better. So the message is still powerful in the media as far as vaccinations. And in the United States, we're a vaccine-centric country. And there are other things out there for treatments like monoclonal antibodies, which do help. And I'll explain what those are in a second. In addition to the difficult to ignore, but I think robust data with ivermectin, fluvoxamine, and a few other things that have worked just because there's nothing else out there as far as a treatment plan. And there are medicines that are being released slowly through the pipeline under Emergency Authorization Act. So it is going to be a chronic disease. So since it's going to be a chronic disease, we're going to be getting vaccines for a long time. And if you don't take care of these things, like your body weight, body mass index, high blood pressure, cholesterol issues, glucose issues, autoimmune disease, ANA positive, that means autoimmune disease that is turned on your antibodies to attack self instead of attack other things, that's a problem. But those are all immunodeficiency issues, medical problems, and they do set you up, those comorbid conditions do set you up for a worse outcome if you do get exposed. And there's going to be other variants going down the Greek alphabet till it gets to Omega. Now, the idea is, again, we'll see what happens. I'm sure this little bit of a surge, which is, who knows, but I think that sensationalism is too hard to ignore with the media. But you're going to see little spikes here and there. In fact, I think Israel's already closed its doors or put a travel ban on South Africa. It seems to be where this Omicron was first discovered. It's probably all over the place. But in the United States, we're not testing for that. We're just testing for what? We're just testing for the PCR and the rapid test in the nose and mouth. not even testing for antibodies, which I think you should. But if you're my patient and you're thinking about a segue into this, if you're thinking about a booster, I think the third shot is fine, and we're going to have fourth and fifth and sixth shots going forward. But my suggestion is you do it the proper way. Check quantitative spike protein. So when you do get infected or you do get the vaccines are based on giving you a fake spike protein introduced into the system, and the antibodies will react to that fake spike protein and give you a little bit of a immune response, meaning a fever, chill, and body aches. Some people are having the nastiest side effects from post-vaccine, arm pain, fevers and chills, and other things. I think it's because of the mast cells and your immune system turning on a little bit too aggressively. But bottom line is that if you do have an opportunity to get the vaccine, I think it does help. And I'm not for the strong camp of vaccines, and I'm not against it, and I'm not an anti-vaxxer, but I do look at the evidence, and from the spikes that occurred about this time into March last year, there were decreases in the surge, and that happened to correlate with vaccines. So the vaccines do work to decrease severity. They don't work to prevent and cure. In fact, their durability is very limited. Unfortunately, there's no data, or there's limited data on the durability or the length of time that your antibodies will be positive if you had the infection, because I don't think anybody wants to investigate that. All the drug companies want to investigate how long the antibodies stay positive in the test subjects that have had the vaccinations, Pfizer, J&J, or Moderna. So there's data there, but there's no data elsewhere. Now we can go to Israel, UK, and other places of the world that are loading up the data and accumulating data. But again, it depends on what's going on in the rest of the world and what's going on with you. If you have issues, take care of them. If you haven't been vaccinated, that's fair, but I honor that. Just think about following the FLCCC.net's protocol for vitamins, and I think it's strong. They were formed and popularized, that group of doctors was popularized around the same time as the Italian surge, when everybody was dying and there wasn't any ideas on how to help these people and unload the hospitals. So doctors were getting together and exchanging information across the world. And there were some hard to ignore protocols that were established. And I do think that their vitamin protocol is strong. It's only vitamins, and off the top of my head, you have vitamin D, zinc, quercetin, vitamin C, melatonin. There's also aspirin as well, but there's specific doses. So please go over to flccc.net, check out their vitamin protocol if you're not going to get your vaccination. If you are on the fence as far as getting a vaccination, perhaps come see me and I'll order a quantitative COVID spike protein test and see if you had the exposure. Some people can fly through an infection, not even notice it, one day of a stuffy nose, and they actually have positive protection. I've had a handful of people like that. So if that's you and you're on the fence about getting a booster, if your antibodies are still, the quantitative antibodies are still greater than 20, I think it's fair to wait. And what I'm doing with a lot of my guys is I'm checking every 3 months. Considering the durability of the vaccine as being 6 months, I'm just testing my folks every 3 months with regards to quantitative spike protein and seeing when it falls. I already have one person I tested in the spring. It was greater than 20. Now she's down to about 8. So it's starting to fade. I'll check her in another couple months. And when it gets down to what I would consider significantly poor levels of antibodies, time to get an antibody booster or a vaccine booster. But until then, I think you should wait. The data from the UK was that they waited between vaccines until the durability of the first shot started to fade. Then they gave the second booster in the 2 series. Here in the United States, we went within 3 weeks to get the second booster, and I think our durability is lower than the UK's, suggesting that if you wait a little longer until the antibody level fades, you have a better outcome and a more durable immune system. So something to keep in mind. And for those of you who are not getting the vaccination, and you're maybe following the vitamin protocol already, taking that stuff every day, that's 5 different vitamins every day, plus or minus the aspirin, I would always have ivermectin on call. So the data on ivermectin and fluvoxamine, that's another medicine that had been repurposed. There was definitely a propaganda release to poo-poo ivermectin, especially when the first parts of your sentence on talking about a news bulletin is horse pill. And I think that's unfair because it is used for horses. It's also used for humans. In fact, the data, as I've put down in my previous video, so check it out, the data is very strong in the use of this medicine for parasites. And even though parasite treatment is slightly different as far as the formula for figuring out the proper dose, it's a little bit different than treating COVID, but if you look at we're only doing this to look at the side effect profile, and the side effect profile is essentially 0, maybe an upset stomach, thus you're supposed to take it with food. However, the forces that don't like ivermectin because it isn't robust enough data, that there isn't any other data out there, so I'm not sure what you're comparing to, but there's no downside with the side effects. I think it's worth it because I have folks that call me at the last minute to join on the COVID protocol that I have, and usually it's a 3-month subscription. I follow patients during the first couple weeks, and then we slowly march them out until they're back to normal, because a lot of crap happens, not only the infection, but there's lasting effects that I think need extra help. A lot of my patients don't need that, but it's still better to have the established connection with me sooner than later. So if you get a positive exposure and you start to have fevers, chills, nausea, vomiting on, say, Friday, and you sign up on Friday morning, and I get the notification and maybe we discuss things Friday night, I have to get a telephone message to the the compounding pharmacy of choice, because it's hard to find ivermectin in your average pharmacy. So we have to go to specialty pharmacies, compounding pharmacies. There's only a handful in my area, but that takes time. So I have to call the order in, and then they have to send it out. Or I guess you could pick it up. But because they're so sparse, Wakanda is their compounding pharmacy. Kiefer is another compounding pharmacy. Mark Drugs. There used to be a Martin Avenue. I haven't seen them lately. So there's a couple different compounding pharmacies that are out there, even out of state, that'll ship into state. But that's still time. And the longer you wait, or the longer you delay the initiation of ivermectin, the less the effectiveness. So I have some folks who frantically try to call me on my office phone saying they got infected, they got exposed, they're positive, and they need help. But it's still, I still have to see those folks, and we still have to schedule a visit, and then I have to call in the ivermectin. So it might be better if you have a lot of comorbid conditions that you sign up beforehand. Now, I know that's a tough buy-in because I don't take insurance, and it is an investment, but if you have comorbid conditions, you should be invested in changing your lifestyle. Maybe that little Band-Aid will keep you safe while you're changing your lifestyle, because nothing happens overnight. If you're obese, BMI greater than 30, have diabetes, have elevated cholesterol, high blood pressure, that's not going to reverse itself in a year's time. It takes a lot of effort and investment. So sometimes maybe hiring me to help you make those changes, and then I automatically just give you an ivermectin pack just in case. I think that might be an option. So you can always do one consult with me, lifestyle. Or again, if you are high risk and you've been exposed, you can immediately get on the COVID community that I have and sign up for that. But bottom line is that we have this. It's going to be forever. Please work on your comorbid conditions, because it's going to be an endemic problem. And if you haven't heard the government talk about changing your comorbid conditions and only talk about vaccines, that's because nobody's talking about it except for me. I really think that you have to change those things. And if this wasn't a kick in the ass to get you moving, wait till you get infected. Because even if you have the vaccine, even if you had previous infection, I have patients that are not doing too great, and they feel terrible, down and out. I had one patient, go to the hospital for monoclonal antibodies. It was okay. Had one that was admitted for treatments, respiratory, IV hydration. It was okay. But all that supportive stuff was just to get them through so that their immune system, so they were okay with hydration and comfort, but then their immune system was still responsible for reversing the disease and getting back to normal. And you can't do that if you have comorbid conditions. It'll be much slower. It'll be the difference between 4 days of being sick, like I had back in November of 2020, versus weeks of being sick and feeling lousy. One thing is to be sick and call out sick for the couple of days or the week. But the other is every minute of every day you have body aches, headache, nausea, vomiting, can't walk, fevers and shaking chills. That stuff is intolerable. It's certainly you're going to live through it, but it's not a great life. So please change your life. Maybe sign up with me if you don't know how to change your life. Or if you are exposed and you're sick, get on my website ASAP. I'll put the link down below. Just stay safe. We're going to be going through this in 2022 and further, but I am really hoping that 2022, amidst all this variant stuff and politics, it'll be a year of hope. And I'm trying to get my warriors to see the light in a different framework. So if we can reverse disease, at least locally, individually, then we're cool. Maybe others will follow. So stay safe. Thank you for watching up to this point in time. Don't forget to hit the like button if you enjoyed this, and share it with other people, because it helps the algorithm of YouTube and it helps support my channel so I can continue doing more videos. And I am making a change. I've moved offices a bit, but I've been kind of silent lately. However, I'm getting ready for 2022 as well, year of hope. Thanks for watching. I'll talk to you at the next one.